Good evening, guys. I have discussion C for you. Tonight we're discussing the the risks the risks that older seniors who have conditions use medical cannabis. The harmful effects of cannabis for seniors. So we're discussing that tonight for C. So please join me in tonight's presentation that I made for you. Here we go. The article titled as cannabis users age, health risks appear to grow, explores the growing concerns around cannabis use among older adults. Here are some key points. Aging and cannabis use. Increasing use among seniors. More older adults are turning to cannabis, often for sleep issues, pain, or anxiety. Case study: a 76-year-old woman consumed 4 cannabis gummies, each with 10 milligrams of THC in one evening, leading to anxiety and heart palpitations. She had underlying conditions like high blood pressure and arterial fibrillation. Health risks. Give me 1 second, guys, and I'll have that for you. Overconsumption. Seniors may misjudge dosage due to delayed effects, increasing risk of adverse reactions. Drug interactions. Cannabis can interact with prescription medications, potentially causing complications. Fall and injury risk. Dizziness or impaired coordination from cannabis use can lead to falls or accidents, especially in frail individuals. Medical guidance. Start low, go slow. Experts like Dr. Benjamin Han recommend beginning with low doses, 1 to 2.5 milligrams THC, and gradually adjusting. Emergency visits. Well, the woman in the case study wasn't seriously harmed. Her experience underscores the need for caution. Would you like to explore how these insights could inform frailty aware or culturally responsive care models for aging populations? From the study highlighted in the article, as cannabis users age, health risks appear to grow. We can draw several important lessons about cannabis use among seniors. Key learnings. Raising usage among older adults. Seniors increasingly turn to cannabis for issues like insomnia, chronic pain, and anxiety. This trend reflects broader shifts in attitudes and accessibility, but it also introduces new health considerations, psychological vulnerabilities. Aging bodies metabolize substances differently, making older adults more susceptible to side effects. A case study of a 76-year-old woman illustrates how even moderate consumption, 40 milligrams THC via gummies, can trigger anxiety and cardiac symptoms, especially with pre existing conditions like hypertension and arterial fibrillation. Risks of misjudging dose. Delayed onset of edibles can lead to overconsumption. Guys, it's a real important issue that is in society today for people using for pain relief. Um, Make sure if someone you know has that uses this for medical reasons, make sure they understand the dosage and make sure they use it correctly for that purpose only. Seniors may not be familiar with potency or timing, increasing the likelihood of adverse reactions, drug interactions, and safety hazards. Cannabis can interact with common medications, complicating treatment regimens. Impaired coordination or dizziness raises the risk of falls, particularly concerning for frail, for frail or mobility limited individuals. Clinical recommendations. Experts advocate a uh, start low, go slow approach, beginning with 1 to 2.5 milligrams THC. Monitoring and education are essential to prevent emergency visits and ensure safety. Would you like to co develop a culturally responsive framework for cannabis education and harm reduction tailored to aging populations? We could integrate frailty aware principles and community engagement strategies to implement effective harm reduction strategies for seniors using cannabis. We can draw from both clinical guidance and the specific risk highlighted in the article. Okay, harm reduction strategies for seniors using cannabis. One, education and literacy. Label clarity. Ensure seniors understand THC slash CBD ratios, dosage per unit, and onset time. Okay, workshops or counseling offer community-based sessions on safety use, especially for those new to cannabis. To start low, go slow. Begin with 1 to 2.5 milligrams THC as recommended by geriatric experts like Dr. Benjamin Hahn. Use CBD dominant products when possible to reduce psychoactive effects. Medical oversight. Encourage consultation with healthcare providers to assess drug interactions and cardiovascular risk. Cognitive or mobility impairments. Product selection. Favor non-cannabis forms, e.g., tinctures, low-dose edibles to reduce respiratory strain. Avoid high-potency or fast-acting products unless medically supervised. Monitoring and support. Implement check-in systems for seniors living alone, especially after initiating cannabis use. Train caregivers to recognize signs of overconsumption or adverse reactions. Environmental safety. Reduce fall risk by ensuring safety, home environments, grab bars, non-slip flooring. Okay. Avoid cannabis use before driving or operating machinery. 7. Culturally responsive outreach. Tailor messaging to reflect cultural attitudes towards cannabis and aging. Use trusted community figures or multilingual materials to increase engagement. Would you like to co-design a participatory toolkit or community guide that integrates these strategies into aging friendly, culturally attuned care models? We could align it with your work on frailty aware or memory friendly interventions. Okay, guys, so that's C for you. I'll try and do another one later tonight. If I don't, I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.